Hello, my name is Kim Staten. I'm the Whole Health Navigator with Augusta Care Partners in the Life Wellness Program. I'm going to walk you through the key to understanding biometric screenings. It is my privilege and pleasure to present this information. Other than to ask you to drive safely or avoid touching a hot stove, I cannot think of one other bit of information that I can tell you that would have more impact on your current and future health and longevity than what I'm about to share with you today. Thank you for this opportunity. Recent research has found that 88% of U.S. adults have at least one marker for something called metabolic syndrome. That sounds like bad news, but the good news is all of us have control as to how this unfolds in our own life. It's up to you. Understanding this information has helped countless people turn things around for the better. It's never too early and it's never too late to begin this journey, so let's get started. Some of you might not know what metabolic syndrome means, so let's briefly break that down. Metabolism is the process by which your body converts what you eat and drink into energy. A syndrome is a cluster of symptoms that consistently occur together. So metabolic syndrome simply is a dysfunction in the process of converting food to energy as defined by meeting at least 3 of the 5 criteria for metabolic syndrome. The tree you see here is the perfect analogy for our discussion today. In the top of the tree, you can see 5 of the 7 measurements that we gather for biometric screenings. These 5 tests relate to the 5 criteria for metabolic syndrome. Your results from these tests can give you so much information on your current state of health, but you might even say too, they can predict the future. These tests are waist circumference, blood pressure, fasting blood sugar, triglycerides, which is a type of fat found in the blood, HDL, or high-density lipoproteins, sometimes called the good cholesterol. The tests are considered abnormal if they are out of normal range or if you are on medication to manage the condition. So any one of these results can be abnormal for a particular reason. But if you start to see these abnormal results cluster together, then you will recognize this as metabolic syndrome. And this should get your attention. The exciting news is, based on what I'm about to share with you, is that you don't have to wait until it has become advanced to do something about it. So what is happening in the body to cause these results to be abnormal and cluster together? The answer is high levels of insulin. When some people hear the word insulin, they might think about medication that diabetics inject to lower their blood sugar, but we are referring to the insulin that we make in our bodies. Insulin is a hormone made and secreted by the pancreas. Normally, insulin is secreted when there is a rise in blood sugar, and then, ideally, insulin levels return back to a normal baseline. Insulin is like a key that unlocks the body's cells, allowing sugar in where it will be used for energy. Insulin is also a fat-storing hormone, so if there's leftover energy that is not needed by the cells, then insulin will store this as fat. Insulin is an amazing hormone. For much of human existence, insulin enabled us to adapt to food scarcity. Our ancestors had to hunt and gather food. Sometimes they found it, sometimes they didn't. It was often feast or famine for them. What they did find supplied their current energy needs, and energy for future use was stored as body fat. Body fat was fuel for periods of food deprivation. Our bodies evolved in an environment of food scarcity. Food abundance, in the context of all of human history, is relatively new. In our day and age, many people don't have to worry about long periods of food deprivation. We have been afforded the opportunity to eat whenever we want and in the amounts that we want. This abundance is a big contributor as to why more than 8 out of 10 U.S. adults are found to be metabolically unhealthy. So how are chronically high levels of insulin causing the abnormal results that we are seeing on these 5 tests? Let's look at the blood pressure first. High insulin causes the release of hormones that tells our kidneys to hold on to salt and fluid, and it tends to constrict our arteries. This is the perfect recipe for high blood pressure, and very likely a common cause of high blood pressure. What about waist circumference? We've already talked about insulin as a fat-storing hormone. Fat can be stored under the skin, but eventually, at some point, fat can start to be stored in and around our organs, such as the liver and the pancreas. This is known as visceral fat. The word visceral means organ. Organ or visceral fat is a significant problem. It is highly inflammatory and a major player in metabolic syndrome. The increased waist circumference checked in biometric screening can be a clue that fat might be accumulating in and around the organs. What about triglycerides and HDL cholesterol? Triglycerides are a fat in the blood, and elevated triglycerides are dangerous. HDL cholesterol is a recycler of particles that could be harmful if left in the bloodstream. When HDL is low, we lose its recycling benefits. These two markers, when abnormal, are strong predictors of heart disease and insulin resistance. High insulin and the conditions we just talked about can be going on 5, 10, 15, sometimes 20 years before we even start seeing the blood sugar creep up. It is likely that insulin was working overtime, that is, getting higher and higher to keep our blood sugar under control for all those years. At some point, something gives and we start to see the blood sugar rise. So what is happening? 1, the pancreas may no longer be able to make enough insulin to keep up with the blood sugar. But 2, more likely, insulin has been so high for so long that certain cells of the body have simply stopped listening to it. It's like putting your fingers in your ears to block out continuously loud noise. So insulin is present. It's probably circulating in high amounts, but we are requiring higher and higher levels of insulin to get the cell's attention. When the cells stop responding to insulin, and it takes more and more insulin to do the job, this is known as insulin resistance. You can probably figure out where we're headed. This is the pathway to type 2 diabetes. Not everyone will get there with the same cluster of symptoms. Some people may get there faster than others. And some people may never get type 2 diabetes, but just because the blood sugar is not elevated does not mean that a person is not experiencing other detrimental effects of elevated insulin in other ways. Let's clarify the difference between type 1 and type 2 diabetes right now. Type 1 is when someone's pancreas is damaged by a virus or autoimmune disease and the pancreas can no longer make any insulin. These folks have to inject insulin in order to manage blood sugar and survive. Type 1 diabetes is a shortage of insulin. Ironically, type 2 diabetes is a disease of too much insulin. With the development of type 2 diabetes, the risk of heart and vascular disease worsens. So what causes high insulin and insulin resistance in the first place? I've got good news and bad news, but mostly good news. Metabolic syndrome and type 2 diabetes are truly a disease of diet and lifestyle. As you can see here, eating excessive carbohydrates or carbs, the lack of physical activity, and or obesity are root causes of metabolic syndrome and type 2 diabetes. The good news is the root cause is within our control. Certainly there are genetics at play. We may have a family history of, say, high blood pressure or diabetes, but this is not etched in stone. Please don't throw up your hands and think there is little hope if you have this family history. More than you realize, we have control as to whether we flip that genetic switch. More good news. Even if metabolic dysfunction has started, we can still take action to reverse it. As I've mentioned, carbohydrates are converted into sugar in the body, and this sugar triggers the release of insulin. When we eat carbohydrates beyond our individual ability to tolerate them, and everybody's different, it causes our insulin to go up. People who are metabolically healthy can handle carbohydrates without ill effects. Please try not to hate them. But those of us who are showing signs of metabolic dysfunction need to be mindful of our carbohydrate intake. So if we tend to eat high-carb meals and then have high-carb snacks between meals, our insulin goes up and it just stays up. Our body never gets a break from insulin. It's the breaks between carb intake that helps lower our insulin levels and gives the body time to heal and retrain so our cells start listening to insulin again. A great start to healing is to eat lower carb foods, cut out snacks, especially processed foods made of sugar and refined flours. Physical activity helps drive insulin down and it makes our cells more efficient at using sugar. If we're inactive, we lose that helpful partnership between diet and exercise. Muscle is a big sugar burner, and it's one of the biggest storehouses for sugar. Physical activity helps use the sugar stored in the muscles and makes room for more. Exercise can also help reduce stress, which is advantageous, as stress can raise our blood sugar without even eating. If you notice yourself thinking, okay, good, I'll just exercise and then I won't have to change my diet, it's worth clarifying you can't outrun a bad diet. If someone is experiencing metabolic dysfunction, exercise alone is not the remedy. They need to change their way of eating, first and foremost, and partner this with exercise to be effective. Obesity is a 1-2 punch. At first, it may be a sign that we're eating too much energy and we're storing it as fat. But at some point, especially if fat is getting stored in and around our organs, it is becoming part of the problem and no longer a symptom. There are differences in how people put on weight. Some people may be inclined to store a lot of body fat before storing it as visceral fat. Other people may be inclined to just put on 5 or 10 pounds before storing it as visceral fat. These people may not look overweight at all, but they are on the fast track to metabolic syndrome and diabetes. We cannot accurately assume the degree of our own or another person's metabolic health just by appearance. It's also worth mentioning that certain groups of people, particularly those of Asian ancestry, are genetically inclined to put on visceral fat more quickly while appearing normal weight. We are keenly aware of all these differences as we help you navigate the biometric screening process. There's a lot of fallout from the progression of metabolic syndrome. I've recently heard a talk where a physician said, high insulin is the common soil of many, if not most, metabolic diseases. The medical conditions we will talk about here have been referred to as the diseases of the modern era. Not because these are brand new diseases, but rather because they're occurring in such epidemic proportions. They have been on the rise since the early 1970s. These conditions are either caused by or made worse by elevated insulin and insulin resistance. And I might add that this is a growing list as the effects of high insulin are actively being researched. Now, we all know to be on the lookout for stroke and heart disease. These are on our radar. High insulin and insulin resistance play multiple roles in the development of stroke and heart and vascular disease. We've already talked a bit about fat in the liver, otherwise known as non-alcoholic fatty liver. Fatty liver caused by food takes the same course as fatty liver caused by alcohol. The liver becomes inflamed. This can turn into fibrosis and then cirrhosis and ultimately liver failure. The only treatment at that point is a liver transplant. But non-alcoholic fatty liver is reversible if caught before damage is done. It only takes the loss of 7 to 10% of total body weight in order to start to back the fat out of the liver. Fatty liver is not a done deal. Certain types of dementia are now being termed type 3 diabetes because they are coming from this place of metabolic dysfunction. Gout is another interesting finding. Evidence suggests that high insulin and insulin resistance may play a key role in causing high levels of uric acid. Elevated insulin has a strong association and a common condition of women known as polycystic ovarian syndrome, or PCOS. Insulin inhibits the conversion of androgen to estrogen in the ovaries, causing infertility and other problems. Men can experience sexual dysfunction due to vascular changes. This can happen well before the blood sugar levels become elevated. Benign prostatic hypertrophy is associated with insulin growth factor, which is secreted along with insulin and signals cells to grow and proliferate. High insulin levels contribute to weight gain and can lead to airway obstruction. Obstructive sleep apnea can improve with weight loss. Elevated levels of insulin causes a chronically inflamed, house-on-fire state and can trigger various forms of inflammation, including osteoarthritis and other painful or inflammatory conditions. Patients have reported a decrease in pain when they have successfully addressed their metabolic issues. These improvements may not be related to weight loss alone, but rather the benefits of decreasing their inflammation. Certain cancers have been found to be caused by or made worse by the effects of high insulin. Lab studies have found that breast cancer tumors have 7 to 10 times more insulin receptors than normal breast tissue. This shows an affinity of cancer cells for sugar and glucose. An insulin growth factor, which signals cells to proliferate and grow, is a signal we don't want to give cancer cells. Can you relate to this? Year after year, I would go for my annual physical and worry about whether my blood sugar had gone up, and then feel really relieved when it hadn't. Year after year, I worried, but eventually, though, lab work did show my blood sugar was starting to elevate. This tree turned upside down is to demonstrate how far down the cascade of events rising blood sugar can show up. There is a lot of damage that can be done if we're waiting for elevated blood sugar to be the first sign of a problem. Why not catch it sooner? When we were developing this talk, we had 3 different physicians vet this information. I feel like what each of them said contributed to a deeper understanding of the bigger picture. The first physician pointed to the roots of the tree, where it says carbohydrates, exercise, and obesity, and said, "Ooh, I like that." And I said, "Yes, because it's the root of the problem." And she said, "Yes, but it's also underground, and it's been going on a long, long time before you see what's happening." Do you see the root where it says excessive carbohydrate intake? Well, the original draft said excessive calorie intake. But our second physician said, nope, change that to carbohydrates. It's the carbohydrates that turn into sugar in the body and the sugar that triggers the insulin. Last but not least, the third physician pointed to the test in the top of the tree and said, we need to treat the blood pressure when it's up, the blood sugar if it's high, and the cholesterol if that's not normal. But treating those things are just Band-Aids if all of this is going on. And she was pointing to the elevated insulin and all of the conditions that arise from metabolic dysfunction. You see, it's like treating the fever but not the infection. If we're content to treat the symptoms of high insulin but not the root cause, we can still expect the consequences and progressive problems. An insulin researcher from Brigham Young University, Benjamin Bickman, says it best. It is remarkable that in the midst of trying to find the best drug to push glucose out of a diabetic body, more people don't simply decide to try putting less glucose into the body. Okay, your mind might be a swirl of information right now, but I want you to walk away with 5 good news points. 1, if you find yourself near or in the throes of metabolic syndrome and high insulin or even type 2 diabetes, it's possible to start backing your way out of this. People are successfully doing this. 2, it's never too late to start. 3, it does not require expensive medications, supplements, or treatments. On the contrary, it requires you knowing what to do and doing it. But if you're already on medications, you will need to work closely with your doctor to adjust your meds as you make these changes. 4, if you learn to eat and exercise in a way that keeps your insulin low, the rest will fall into place. And 5, you are not alone. Augusta Life Wellness is here for you and is offering a variety of programs to support and get you started on the path to metabolic health. We're here to help.